If you feel like your dental cases are taking longer than they should, it's not because you're slow, it's because of these two mistakes. Once you fix them, you can easily cut 30 minutes off of every dental procedure. Let me show you how. Mistake number 1. Using a too small sensor for your x-ray. I hear vets complain all the time that dental x-ray just takes too long and the clients don't want to pay for all these pictures. Especially if you're from Germany, you have the GOT system that you have to oblige to. It means that you have to charge for every single picture. So in Germany, you cannot make a full mouth x-ray package if you want to oblige with the law. So how do we fix that? One vet clinic that I recently visited told me they were not taking full mouth x-ray on all patients, especially dogs, because it just took too long. So I asked them, can I see your x-ray sensor? And they showed me this tiny little size 1 digital sensor. Okay, I understand why it takes too long. I could not take full mouth x-ray with a sensor that small. It would take a lot of time and you would be missing roots and you would have to take too many pictures. So I understand that taking 25 pictures with this would increase the cost a lot. So what's the solution? We implemented another x-ray system. It's an investment upfront, of course it is, but here's the thing. Once they started using size 4 plates, which is bigger, they could reduce the amount of pictures they need to get a full mouth. Actually, they could shave it down from 15 to 20 pictures to 6 to 8 radiographs to get an overview of the entire mouth. That meant that the time they spent taking x-rays was significantly cut and the price to the owner was also lowered. So now they could take full mouth x-ray without even raising the price for the owner. However, now that they're taking x-rays of every tooth, they find a lot of pathology that needed treatment. So they also stopped sending patients home with hidden disease. So it's a win-win. Mistake number 2. Not doing intraoral nerve blocks. Okay, I understand nerve blocks can be a little bit scary because you've all heard that story of a patient waking up and biting its tongue to pieces and bleeding all over the place, and you don't want this to happen. So you're scared to start. You don't know how exactly to place these nerve blocks, where to insert the needle, how much to inject, and so on. But doing intraoral nerve blocks can be very fast and very safe. And here's how you can save time by using dental nerve blocks. Let's imagine you have a patient on the table. You did not place any nerve blocks. Once you start to extract the tooth, the dog starts moving around, hyperventilating, sometimes even jumping off the table almost. Not really. But you get my point. This is because of a pain response. Even though the patient is under anesthesia, it still feels pain. So what do you do when this happens? Well, you have to stop what you're doing. You have to ask your technician to draw up some fentanyl or other pain meds to give it IV, set up a CRI, pain medication drip, and you have to wait for this to work before you can start your work again. So you easily spend 5-10 minutes waiting for the pain medication to kick in so you can continue your extractions. What I do is first I do full mouth x-ray of the mouth. Then I do my examination, and then I already know what teeth needs to be extracted. So that's the point where I do the local nerve blocks. That means while you are cleaning the teeth, the nerve blocks are kicking in, taking effect. So when you have to start extracting teeth, the nerve blocks work and you can go straight to work without wasting any time. So if you'd like to learn how to place the nerve blocks, I've made a video right here on how to do the mandible, so the inferior alveolar nerve blocks. So go ahead and watch this video and let me know in the comments what you think.